Welcome to Primetime Health, your reliable source for the latest insights, health tips, and expert advice on achieving and maintaining a vibrant, healthy life. Today, we're taking a close look at a serious and often misunderstood condition: systolic congestive heart failure. If you or someone you love is managing heart health, especially this type of heart failure, stay tuned. We're about to explore symptoms, causes, treatment options, and lifestyle changes that can make a real difference. Let's get started. What to know about systolic congestive heart failure? Systolic congestive heart failure, often referred to as systolic heart failure, is a condition where the left side of the heart progressively loses its capacity to pump blood efficiently. This part of the heart, responsible for delivering oxygen-rich blood throughout the body, begins to weaken and contract less effectively over time. As a result, blood flow decreases, and the body receives less oxygen, which can lead to various complications. In medical terms, systolic heart failure is commonly known as heart failure with reduced ejection fraction, HFrEF. This term refers to the percentage of blood the heart pumps with each beat, called the ejection fraction. In systolic heart failure, this rate drops below 40%, meaning the heart's pumping ability is significantly reduced. The scope of systolic heart failure. Systolic heart failure, also known as heart failure with reduced ejection fraction, HFrEF, is a significant public health concern that affects millions across the United States. Approximately 6.5 million people in the U.S. live with some form of heart failure, and studies indicate that nearly half of these cases fall under the classification of HFrEF. In systolic heart failure, the heart's ability to pump blood effectively diminishes, primarily due to the left ventricle weakening over time. This condition specifically refers to a heart that pumps at less than 40% of its ejection fraction, EF, a key measure of how much blood the heart pushes out with each contraction. For a healthy individual, an EF typically ranges from 50 to 70%. However, for someone with HFrEF, the heart struggles to meet the body's oxygen demands due to inadequate blood flow, leading to symptoms such as fatigue, shortness of breath, swelling in the lower extremities, and fluid buildup in the abdomen. One of the most concerning aspects of HFrEF is its progressive nature, which means that symptoms and heart function may deteriorate gradually over time. The risk of developing systolic heart failure is closely linked to age, with incidences of heart failure dramatically increasing in people over 65. Heart health can decline with age as the arteries become more rigid, the heart muscle loses some elasticity, and conditions like high blood pressure and diabetes put extra strain on the cardiovascular system. Because of this, HFrEF is more common in older populations, who are more likely to have a history of underlying conditions that increase their risk, including coronary artery disease, obesity, hypertension, and diabetes. Managing HFrEF requires a combination of medical interventions and lifestyle adjustments. Given its chronic and progressive nature, those with HFrEF benefit from regular heart health checkups and monitoring by a healthcare provider. These checkups allow for tracking the ejection fraction over time, which is a crucial indicator of how well the heart continues to pump blood. Early detection and intervention are key to preventing further progression of heart failure. For individuals at higher risk, implementing heart-healthy habits early can make a substantial difference in both preventing the onset of HFrEF and slowing its progression. Heart-healthy habits include maintaining a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, engaging in regular physical activity, managing stress, avoiding smoking, and keeping alcohol intake to a minimum. These lifestyle adjustments can help reduce blood pressure, support optimal blood sugar levels, and improve overall cardiovascular health, all of which are essential to reducing the risk of HFrEF. In summary, the scope of systolic heart failure in the U.S. is extensive, affecting millions and particularly impacting older adults. Regular monitoring, a proactive approach to lifestyle management, and awareness of heart health are essential to managing and potentially mitigating the risks associated with this condition. Understanding the progressive nature of HFrEF and making informed choices about one's health can help improve quality of life and may contribute to better long-term heart health outcomes. Symptoms of systolic congestive heart failure. Systolic heart failure, or heart failure with reduced ejection fraction, HFrEF, often progresses gradually, with early symptoms surfacing only during physical activity. However, in some cases, symptoms may appear suddenly and even become apparent at rest as the condition advances. Recognizing these symptoms early is crucial, as timely intervention can significantly improve quality of life and overall health outcomes. Here are some common symptoms to be aware of. Increased heart rate and heart palpitations. As the heart strains to circulate blood effectively, it may start to beat faster, sometimes leading to irregular or skipping beats. Many patients describe these sensations as palpitations or a feeling that their heart is racing unexpectedly. This increased heart rate is a natural response, as the body attempts to compensate for diminished blood flow and oxygen delivery. Shortness of breath, dyspnea, especially when lying down or sleeping. Shortness of breath, or dyspnea, is one of the hallmark symptoms of heart failure. In the early stages, this symptom may only present itself during physical activity, but it can progress to the point where even slight exertion or lying down causes breathing difficulties. This specific symptom, known as orthopnea, can make sleeping challenging for many, as fluid shifts toward the chest when lying flat can worsen breathlessness. Some individuals may even experience paroxysmal nocturnal dyspnea, where they awaken gasping for air in the middle of the night. Persistent cough or wheezing. A chronic cough or wheezing can develop as fluid builds up in the lungs, leading to a sensation similar to asthma or bronchitis. This symptom is especially common in those with significant fluid retention due to heart failure and can worsen at night when lying down. The cough may produce white or pink-tinged mucus, which is often a sign of fluid accumulation in the lungs. Weight gain and fluid. Buildup in the abdomen, ascites. Rapid, unexplained weight gain is often an early sign of fluid retention. When the heart struggles to pump blood effectively, fluid may accumulate in various areas of the body, especially in the abdomen. This buildup, medically known as ascites, can cause a feeling of fullness, discomfort, or even pain in the abdomen, which may impact appetite. Leg swelling and bulging neck veins. Edema and jugular vein distension. Edema, or swelling in the lower extremities, is another common symptom of heart failure. It typically begins in the feet and ankles, but can progress to the legs. This fluid retention can make it difficult to walk and may result in skin that appears shiny and stretched. Additionally, jugular vein distension, JVD, a visible bulging of the neck veins, can signal increased pressure in the blood vessels, often seen as heart failure progresses. Loss of appetite and occasional confusion. Many people with systolic heart failure report a reduced desire to eat. This may be partly due to fluid retention in the abdomen, making them feel full quickly, but also due to decreased blood flow to the digestive organs, affecting hunger signals. In more severe cases, insufficient blood flow to the brain can cause confusion, memory problems, and difficulties with concentration. Understanding the variability of symptoms. Not everyone with systolic heart failure will experience all these symptoms, and their severity may vary. Some individuals may experience one or two prominent symptoms, while others may feel the impact of multiple symptoms at once. This variability makes it essential to recognize even subtle changes in physical health. Reporting symptoms early and consistently can empower healthcare providers to tailor treatment and potentially slow the progression of the disease. If any of these symptoms are present, particularly if they worsen over time, seeking medical advice is crucial. An early diagnosis can lead to effective interventions and lifestyle adjustments that may help manage the condition and improve long-term outcomes. What causes systolic congestive heart failure? Systolic congestive heart failure, often referred to as heart failure with reduced ejection fraction, HFrEF, occurs when the left ventricle of the heart, the main pumping chamber, enlarges and loses strength over time. This gradual weakening limits the heart's ability to contract forcefully, thereby reducing the amount of blood that circulates throughout the body. While various factors can contribute to this condition, two primary causes stand out. 1. Coronary artery disease, CAD. Coronary artery disease is the most common underlying factor in systolic heart failure. It occurs when the arteries supplying oxygen and nutrients to the heart muscle become narrowed or blocked, typically due to plaque buildup. Reduced blood flow to the heart muscle deprives it of the oxygen needed for proper functioning, eventually causing parts of the muscle to weaken or even die. As the heart muscle sustains damage over time, it loses the ability to contract efficiently, leading to heart failure. 2. High blood pressure, hypertension. Long-term high blood pressure is another leading cause of systolic heart failure. When blood pressure is consistently elevated, the heart has to work harder to pump blood throughout the body. This extra workload causes the heart muscle, especially the left ventricle, to thicken and stiffen. Over time, this extra effort leads to muscle fatigue, making it increasingly difficult for the heart to pump blood effectively. Eventually, the left ventricle can weaken and enlarge, setting the stage for systolic heart failure. Additional heart-related conditions leading to systolic heart failure. Aside from CAD and hypertension, several other heart-related issues can contribute to the development of systolic heart failure. Congenital heart disease. Structural abnormalities in the heart, present at birth, may disrupt normal blood flow patterns and lead to heart failure later in life. These congenital conditions can strain the heart over time, causing it to weaken. Heart attacks. Myocardial infarctions. Heart attacks occur when blood flow to a part of the heart muscle is suddenly blocked, causing muscle damage. This damage reduces the heart's overall pumping ability, especially if multiple heart attacks have occurred. Heart valve disorders. Malfunctioning. Heart valves, which control blood flow through the heart's chambers, can disrupt normal circulation. For example, leaky or narrowed valves force the heart to pump harder, leading to muscle strain, fatigue, and eventually heart failure. Infections. Viral infections, such as the flu or COVID-19, can inflame the heart muscle, a condition known as myocarditis. This inflammation weakens the heart, diminishing its ability to pump blood effectively. Arrhythmias, irregular heart rhythms. Abnormal heart rhythms or arrhythmias can impair the heart's efficiency. Irregular beating, especially if sustained, causes strain and can lead to or worsen heart failure over time. Non-heart-related conditions contributing to heart muscle weakening. In addition to cardiac causes, several non-heart-related conditions can indirectly damage the heart muscle or accelerate the development of heart failure. Some of the most common include type 2, diabetes. High blood sugar levels associated with diabetes can damage blood vessels over time, including those that supply the heart muscle. This vascular damage increases the risk of CAD, which can lead to systolic heart failure. Metabolic syndrome. A combination of high blood pressure, elevated blood sugar, excess abdominal fat, and abnormal cholesterol levels defines metabolic syndrome. Together, these risk factors significantly raise the chances of developing CAD and heart failure. Overactive thyroid, hyperthyroidism. Excess thyroid hormone can overstimulate the heart, increasing heart rate and metabolic demand. Over time, this heightened activity can wear down the heart muscle, contributing to heart failure. Understanding these causes is essential for managing risk factors and implementing lifestyle changes to protect heart health. While some factors, such as congenital heart defects, are beyond one's control, others, like high blood pressure and diabetes, can often be managed through medication, diet, and exercise, potentially reducing the risk of developing systolic heart failure. How is systolic heart failure diagnosed? Diagnosing systolic heart failure requires a comprehensive evaluation that includes medical history, physical examination, and several key tests to assess heart function and pinpoint the cause. Here are some of the most common methods used to diagnose systolic heart failure. 1. Electrocardiogram, EKG or ECG. An electrocardiogram records the heart's electrical activity through electrodes attached to the skin. It helps identify irregular heart rhythms, prior heart attacks, and areas where the heart muscle may not be receiving adequate blood flow. Abnormalities in the heart's electrical signals can suggest conditions like arrhythmias or signs of previous heart muscle damage, both of which are potential contributors to systolic heart failure. 2. Chest X-ray. A chest X-ray provides a view of the heart, lungs, and surrounding structures. This scan can reveal if the heart is enlarged or if there is fluid buildup in the lungs, a common sign of congestive heart failure. X-rays are especially useful for spotting changes related to heart failure's impact on lung circulation and for ruling out other causes of symptoms, such as pneumonia. 3. Echocardiogram. An echocardiogram uses ultrasound waves to create detailed images of the heart's chambers, walls, and valves. It is one of the most informative tests for diagnosing heart failure, as it reveals the heart's size, structure, and pumping efficiency. An echocardiogram can measure the ejection fraction, EF, the percentage of blood pumped out of the left ventricle with each beat. An EF below 40% is a strong indicator of systolic heart failure. 4. Exercise stress test. During an exercise stress test, patients are typically asked to walk on a treadmill or ride a stationary bike while their heart rate, blood pressure, and breathing are monitored. This test assesses how well the heart responds to physical stress and can help detect coronary artery blockages or identify issues with blood flow to the heart muscle. For those unable to exercise, medications may be used to simulate the effects of exercise on the heart. 5. Cardiac catheterization. Cardiac catheterization is a minimally invasive procedure in which a thin tube, catheter, is inserted into a blood vessel, typically in the arm or groin, and guided to the heart. This allows healthcare providers to directly measure pressures within the heart, assess how well the heart is functioning, and check for blocked arteries. If blockages are found, a catheterization can also provide treatment, such as placing a stent to open narrowed arteries. 6. Blood tests. Blood tests can reveal underlying health issues and measure specific markers associated with heart failure. One commonly measured marker is B-type natriuretic peptide, BNP, a hormone produced by the heart in response to increased pressure or heart strain. Elevated BNP levels often indicate heart failure. Other blood tests may check for markers of inflammation, kidney and liver function, and electrolyte levels, all of which help assess heart health and guide treatment. 7. Additional imaging tests. If further detail is needed, additional imaging techniques such as CT, computed tomography scans, MRI, magnetic resonance imaging, or nuclear heart scans may be recommended. These tests can provide a more detailed look at the heart structure, detect scar tissue from previous heart damage, and assess blood flow to the heart. Each diagnostic step provides valuable insights into heart function and the potential causes of heart failure. An accurate diagnosis helps guide treatment options to improve heart performance, alleviate symptoms, and prevent further complications. Treatments for systolic congestive heart failure. Managing systolic heart failure requires a comprehensive approach that can involve medications, medical devices, lifestyle changes, and sometimes surgery. Here's a closer look at the primary treatment options. 1. Medications. Medications are often the first line of treatment, targeting symptoms and helping the heart work more effectively. Key medications include ACE inhibitors, angiotensin-converting enzyme inhibitors. These drugs relax blood vessels, lower blood pressure, and reduce the workload on the heart by decreasing the production of angiotensin II, a hormone that causes blood vessels to constrict. Common ACE inhibitors include enalapril, lisinopril, and ramipril. Beta blockers. Beta blockers slow the heart rate and reduce the force of contractions, allowing the heart to pump blood more efficiently and reducing symptoms of heart failure. Medications like carvedilol, metoprolol, and bisoprolol are commonly prescribed beta blockers. Diuretics. Known as water pills, diuretics help the body eliminate excess salt and water, reducing fluid buildup and swelling in the legs, abdomen, and lungs. This helps alleviate symptoms of breathlessness and edema. Common diuretics for heart failure include furosemide, spironolactone, and hydrochlorothiazide. SGLT2 inhibitors. Initially developed to manage diabetes, SGLT2 inhibitors like dapagliflozin and empagliflozin have shown significant benefits for heart failure patients. They help reduce the risk of hospitalization and may improve heart function in patients with reduced ejection fraction. Angiotensin II receptor blockers, ARBs. ARBs, such as losartan and valsartan, are sometimes used as an alternative for patients who cannot tolerate ACE inhibitors. These medications also work to relax blood vessels, lower blood pressure, and make it easier for the heart to pump blood effectively. 2. Medical devices. For some patients, medical devices can be life-saving and help manage heart function more effectively. Devices include implantable cardioverter, defibrillator, ICD. An ICD is a small device placed under the skin, typically near the collarbone, that monitors heart rhythms. If it detects a dangerous rhythm, it delivers an electric shock to restore a normal heartbeat. ICDs are often recommended for people at high risk of sudden cardiac arrest due to abnormal heart rhythms. Ventricular assist devices, VADs. These are mechanical pumps that support the heart's pumping function, often used as a temporary solution for patients awaiting heart transplants, or as long-term therapy for those who are not transplant candidates. VADs can greatly improve quality of life in severe heart failure cases by assisting the heart in circulating blood throughout the body. 3. Surgical interventions. In cases where blockages or structural issues severely impact heart function, surgery may be necessary. Coronary revascularization, bypass surgery. This procedure restores blood flow to areas of the heart that have been damaged or weakened by blocked arteries. It involves creating a bypass around clogged arteries using a blood vessel from another part of the body. Heart valve repair or replacement. When heart valve problems contribute to heart failure, surgeons may repair or replace the affected valve to improve blood flow. This procedure can help alleviate symptoms and prevent further damage to the heart muscle. Heart transplant. For patients with severe heart failure who have not responded to other treatments, a heart transplant may be the only viable option. This procedure involves replacing the failing heart with a healthy donor heart. While a heart transplant can be life-saving, it is a complex and high-risk procedure that requires lifelong monitoring and medication. 4. Lifestyle adjustments. Lifestyle changes are essential to managing systolic heart failure effectively and can greatly improve symptoms and quality of life. Recommendations may include reducing salt intake. High salt intake can lead to fluid retention, worsening symptoms of heart failure. Patients are often advised to limit salt in their diet to prevent swelling and ease the heart's workload. Maintaining a healthy weight. Excess weight can strain the heart, so maintaining an ideal body weight through a balanced diet and regular physical activity is beneficial. Staying physically active. Gentle, regular exercise, like walking, swimming, or cycling, can strengthen the heart, improve circulation, and reduce symptoms of heart failure. Patients should consult their doctor before starting any exercise program. Avoiding smoking and limiting alcohol. Smoking damages blood vessels and increases heart strain, so quitting is highly recommended. Limiting alcohol is also crucial, as excessive drinking can weaken heart muscles. Managing stress and sleep. Reducing stress through relaxation techniques, mindfulness, and adequate sleep can improve physical health and overall well-being. Addressing sleep disorders like sleep apnea, which can worsen heart conditions, is also essential. A combined approach with medical, lifestyle, and potentially surgical interventions can help manage and even improve systolic heart failure, giving patients a chance at a better quality of life. The earlier the condition is diagnosed and managed, the more effective these treatments can be. Regular follow-ups and open communication with healthcare providers are vital to staying on top of heart health and adapting treatment as needed. Lifestyle changes to support heart health. For individuals managing systolic heart failure, making positive lifestyle changes can significantly support heart function and overall well-being. Here are some essential adjustments. 1. Reduce salt intake. High salt intake can lead to fluid retention, worsening symptoms like swelling and shortness of breath. Limiting salt in your diet helps reduce the heart's workload. Try opting for fresh foods over processed items, seasoning with herbs instead of salt, and checking nutrition labels for sodium content. 2. Manage weight. Maintaining a healthy weight reduces strain on the heart and helps improve energy levels. A balanced diet with nutrient-dense foods like vegetables, fruits, lean proteins, and whole grains supports both weight management and heart health. Speak with a dietitian or healthcare provider if you need guidance on weight management specific to heart health. 3. Engage in regular physical activity. Gentle, regular physical activity tailored to your fitness level can improve circulation, reduce blood pressure, and strengthen the heart. Walking, swimming, or low-impact aerobic exercises are often recommended. Before starting, consult your doctor to ensure you're engaging in safe, appropriate activities. 4. Avoid smoking and limit alcohol. Smoking damages blood vessels and directly harms the heart, so quitting is crucial. Additionally, reducing alcohol intake is essential, as alcohol can worsen heart failure symptoms and weaken heart muscles over time. 5. Reduce stress. Chronic stress can raise blood pressure and negatively affect heart health. Practicing mindfulness techniques, such as meditation or breathing exercises, can help manage stress levels. Support groups and counseling can also provide emotional support, helping you navigate the challenges of managing heart failure. 6. Prioritize sleep. Quality sleep is vital for heart function and recovery. Aim for 7 to 9 hours of restful sleep each night. Address any sleep disorders, such as sleep apnea, which can increase strain on the heart. Good sleep hygiene practices, like avoiding screens before bed and creating a calming nighttime routine, can support more restful sleep. Making these changes can provide both immediate symptom relief and long-term benefits, helping you manage systolic heart failure more effectively and improve your quality of life. Regular follow-ups with your healthcare provider will help you tailor these adjustments to your needs and keep you on track. Preventing systolic heart failure. Though there's no surefire way to prevent systolic heart failure, you can significantly reduce your risk with proactive, heart-healthy habits. Adopt a heart-healthy diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, like those from fish, nuts, and olive oil can protect the heart. Avoiding processed foods and limiting salt, sugars, and unhealthy fats can also help maintain heart health and reduce risks associated with high blood pressure and cholesterol. Exercise regularly. Engaging in at least 30 minutes of moderate intensity activity, such as walking, cycling, or swimming, on most days of the week keeps the heart strong and improves circulation. Regular exercise can help control weight, lower blood pressure, and improve cholesterol levels. Manage stress. Chronic stress can contribute to heart issues, so finding ways to relax and manage tension is key. Techniques like mindfulness, meditation, or spending time with loved ones can make a difference in managing heart-related risk factors. Avoid smoking. Smoking damages blood vessels and elevates the risk of developing heart disease. Quitting smoking, if applicable, is one of the most impactful choices you can make to protect your heart. Get regular health checkups. Routine health screenings for blood pressure, cholesterol, and blood sugar levels help detect early warning signs of heart disease. Monitoring these factors with your healthcare provider can catch any developing issues early, enabling you to take preventive steps to keep your heart functioning at its best. Living with systolic congestive heart failure. Managing systolic heart failure involves a proactive approach and a commitment to healthy habits. With a combination of lifestyle modifications, prescribed medications, and regular checkups, it's possible to maintain a good quality of life and slow the progression of heart failure. Here are some key strategies for effectively living with systolic heart failure. Track symptoms closely. Being aware of symptoms like shortness of breath, weight changes, or swelling is essential. Sudden changes, especially after a diet shift, illness, or stressful event, can affect heart function. Monitoring these signs and sharing any changes with your healthcare provider can lead to timely interventions. Follow your treatment plan. Sticking to prescribed medications, attending routine appointments, and following your doctor's advice helps manage symptoms and prevents complications. Treatment adherence is critical for optimizing heart function and controlling symptoms. Embrace lifestyle adjustments. Small, sustainable changes make a big impact. This includes a heart-friendly diet, physical activity that suits your fitness level, and practicing good sleep hygiene. Limiting salt intake, staying active, managing stress, and avoiding smoking or alcohol contribute to stronger heart health and better overall wellness. Stay informed and involved. Proactively learning about heart failure and participating in your care decisions can empower you to live well with this condition. Support groups, counseling, or discussions with family can also provide valuable emotional support, helping you stay motivated in managing your health. With early intervention, careful symptom tracking, and consistent medical care, individuals with systolic heart failure can take control of their health, potentially improving their prognosis and enhancing their daily lives. Staying proactive and informed allows you to adapt to challenges and find ways to live actively and confidently with systolic heart failure. Thank you for watching Prime Time Health. If you found this information helpful, be sure to like, subscribe, and hit the notification bell to stay up to date on more health tips and insights. Take care, and we'll see you in the next episode.